things to say about it. So let's look a little bit at a couple different things here and see if this works. Okay, so you guys are going to know these are easy questions maybe. In which country are adults least likely to get a doctor's appointment for the same day or the next day when they've got a condition? Anybody want to vote for Germany or Australia? What about between Canada and the U.S.? Do you think it's easier to see a doctor in Canada than the U.S.?
Yes.
Yes, absolutely.
Maybe in the most rural of rural areas.
Well, yeah, in rural areas, all bets are off, kind of. Yeah, but yeah, you're exactly right, because there's some big rural areas in Canada.
Yeah. Australia too.
Yeah, Australia too. Okay, so I'm going to use a lot of data, and luckily it's before dinner, because I'd put you to sleep if it was after dinner. So I'm going to use different sources. The OECD is the Organization of Economic Cooperation and Development, so it's international. These are the best data we have on some of this stuff. This is good data. It's not fake news. And so physician visits per capita, so number of times you see a doctor in a year. This is per year, so it's all divided up. And so United States, Denmark, United Kingdom, France, Australia, Canada, Japan. What you see is that all these other countries that have so-called socialized medicine, they go to the doctor more often than we do.
That we were healthy.
So maybe we're just so healthy it doesn't matter. We'll get back to that one. Good. That's our hypothesis. Yes, Brandon.
I have a question. What is it that makes Japan way up there at 12.7?
Well, how in the world do they have time to go to the doctor average once a month? More than once a month. It's a different culture. Okay?
It's the cultural.
But people go in other countries, and I don't have to cherry pick this data. We have fewer doctors per capita than most of. So the OECD are the Western European nations. Canada, the United States also includes Turkey and Mexico, a few semi-third world or borderline third world nations, but basically the OECD are our peer group, the people we think we should be able to do better than, or at least as good as. And all the data is terrible. Okay, we got fewer doctors, and we don't even go to the doctor as much. I could show you all this data on and on, but okay. So how much does the U.S. spend annually on health care per person? I shouldn't even expect you to, I mean, everybody I think knows it's a whole lot. It's more than $8,000. And in fact, the current numbers are $9,000. It's basically $10,000 a year when the next data comes out. It'll be over $10,000 per person per year. Despite this high rate of spending, our outcomes aren't very good. So we got the most expensive healthcare in the world. Now this is the kind of graph, you look at this and you immediately get it, right? This is so simple. No, I'll explain it to you. Okay, healthcare spending as a percent of gross domestic product, okay? So how much we're spending on healthcare compared to our total spending on everything. And it starts in 1980 and comes across to 2013. The source is OECD and the Commonwealth Fund, okay? And so all these countries here, here's the U.S. That's the U.S. up here. We spend 17% of all our wealth on healthcare. And then all these other countries are down in here from 11% to 8%. And they've been, their costs are going up a little bit, but they stay relatively, but we keep getting worse. We have the most expensive healthcare in the world, and it keeps getting worse.
Does that include that in countries that have socialized medicine, healthcare is included in their taxes?
So it's the amount of money spent on healthcare, whether by the government, by people out of pocket, by insurance companies, but it's the total amount of the economy.
All whatever their income taxes are, their total income taxes that they pay every year. People in Norway, for example, are still only paying 9.5% of their annual income.
Well, this is the country's wealth.
Okay, so
not individuals' wealth, but the country's wealth.
Norway.
So we are spending a huge amount of our country's wealth on healthcare GDP, of our GDP, gross domestic product.
That's like what our country can produce. And of all the products that we can produce.
Right.
That's what we get back for our
so
healthcare. And
all these countries take care of their citizens in one way or another, and however you want to measure it, we've got the most expensive healthcare in the world. This is a non-controversial statement of fact. Okay. So do we have the best healthcare in the world? You guys know we don't. How do you measure quality in healthcare?
Yeah.
So one way to measure quality would be life expectancy. So here's Macau and Japan and Singapore with high life expectancies, way up over 85-year life expectancy. And here's the U.S., about 79 life expectancy. So we're 51st in the world in life expectancy. Now, life expectancy is not necessarily the best way to look at this. You could also look at infant mortality. We're terrible. You could look at maternal mortality. So that's death in pregnancy or childbirth, or in the months after childbirth. We're terrible. The best way to actually measure how a healthcare system is performing is to look at this complicated thing called amenable deaths. And this is complicated data to extract, and I've only got it through 2011 is when it was published. So amenable mortality are things that we think, people dying of things that we think are treatable. Heart disease, diabetes, stroke, bacterial infections. And this is done on people under age 75. Once you're over that, we don't care what you die of. Okay, no, I'm just kidding. Trying to be fun.
Excuse me.
Trying to be fun. But anyway, amenable mortality is a complicated concept, statistically very complicated, but it is the best single number to evaluate how well a healthcare system performs in trying to help people live a full life. And here, tall numbers are bad. Okay, so we've got the worst amenable. We got more people dying of treatable diseases than all these other countries. We don't have anywhere near the best healthcare in the world. You got a question?
That are dying of those diseases too that commit suicide
Uh-huh.
because of it, because they can't get the health care, they can't get.
That's true, and that doesn't show up in
Yeah.
suicide doesn't show up. Brent.
I'm curious, just if you would, what's the the number on the y-axis? Like, what is that 0 to 100 like indicative of? I'm trying to figure out like how
It's
much
deaths.
worse or better. You know what I'm saying?
Deaths per
Deaths per 100,000.
Deaths per. It's right there.
Deaths,
it's
yeah, it's
100?
okay.
It's
The
100
slides are
deaths?
Per 100,000.
1,000
Okay,
100
gotcha.
per 100,000?
I was looking at it as a
Almost.
percent.
Deaths, out of 100,000 deaths, how many of those were
Gotcha.
amenable to
I
treatment?
understand.
So it's a complicated concept.
No.
But you guys are smart. Okay, so the World Health Organization ranked all the countries in the world. Now, they did this like 12 years ago or something, and they haven't done it again. And they ranked health systems all over the world, trying to make a kind of a global assessment of health systems. They said the French system's the best in the world. That may or may not be true. The U.S. ranked 37th, below Costa Rica, but above Slovenia at least.
Wow.
Should still do another one of these studies anytime soon.
So the question is,
See more things.
will the World Health Organization do this study again? No. And the reason is the United States found this study so embarrassing that they have threatened the World Health Organization. They already have cut their support of the World Health Organization way down. They've threatened to even go worse because they don't want these embarrassing statistics
Wow.
again. It's
You know
pathetic.
what? They should do the study anyway and say the U.S. opted out.
Yeah, yeah.
Because they were so bad.
Okay, so what other countries in the U.S. has a large uninsured population? Anyone vote for any of these?
Greece.
None of the above.
Even Brazil has an underfunded, in a poor country, but they have the aspiration to try to cover everybody. They have a national health system, even though it is not. No other industrialized nation has a large and uninsured population.
Wow.
So this is our map, and Karen mentioned this. So we've got a big blow-up of this. We can send you the PDF. The PDF may actually be on our website. And so this is countries with universal health care. And so red is countries without, okay? Blue are countries that have universal systems. Light blue are countries that are trying to institute, and they're getting there, but they've got a ways to go. And then we've got the two outliers, Afghanistan and Iran,
Iraq.
which have universal
Iraq.
systems in theory.
Iraq.
Iraq, excuse me. Afghanistan and Iraq, not Iran. Iran's light blue. So these two countries have an attempt at universal systems paid for by the U.S. government as part of the war effort. Okay, and we've seen a number of countries come online in the last 8 years who didn't have universal systems before. China has made huge strides because they abandoned their universal system under Deng Xiaoping, and they're, but basically the United States is the outlier here. It's mostly, most of South America even has universal systems, but Africa and parts of Asia are really, that's where countries don't have universal systems. So we stand alone. Most expensive healthcare in the world, nowhere near the best healthcare, and really an outlier in the world. So it's pretty stark, pretty dramatic. And it's not like it's some kind of new idea. Germany, under Otto von Bismarck, started instituting a universal system in 1883. Switzerland, New Zealand. Now, we got the asterisk by the U.S. in 1947, because that's when Harry Truman tried really hard to get a universal system in the U.S., and we could talk about that, what went wrong there perhaps later, but in the interest of time I'll kind of keep moving right now. And then here's Spain in 86, Taiwan in 95. I mean, it just, Canada right around the same time we did Medicare and Medicaid. The Canadians they'd had one in Saskatchewan, they took it across the country. So we've got all these uninsured people. Now, so this is the slide of people uninsured from 1940 projected out to 2026, okay? And this is in millions of people. So you see that in 1940, before we went into World War II, most of the population was uninsured because there wasn't such thing as health insurance really got started during World War II, for the most part. And so the number of millions of uninsured drops, even though the population is rising. And then Medicare and Medicaid, right here in about 1965, reduced the number of uninsured dramatically. Okay, and then it started creeping back up again, and it started flirting with 50 million uninsured. And then here comes the Affordable Care Act. And then here's the projections. So one thing to remember about the Affordable Care Act is that it was never intended to be a completely universal system, okay? It was always projected that at least 26 million people would be uninsured. Today, the official numbers were about 28 million uninsured in the country. We know that's going to rise, and when the next numbers come out, they're going to be pretty close to 30 million uninsured. The Affordable Care Act has not completely come apart yet, but it is being whacked and hacked, and people are losing coverage.
And are people not insuring themselves because of the cost of healthcare for themselves, or because they're believing something else?
Well, we don't really know, because the Reagan administration, what's his name?
Freudian slip.
The current administration under Indiana's CMS, the Centers for Medicare and Medicaid Services, under Seema Verma, who's from Indiana, has drastically cut the amount of support for the Affordable Care Act, which includes some of the data gathering, and but also the money to educate people about the Affordable Care Act and about getting coverage and about finding navigators. So they've cut all this stuff, so we don't really know what's going on, except for we do know the gross data numbers. So the number of insureds is starting to rise, but exactly why is a matter of some speculation.
That's something that I'm seeing. I'm seeing a lot of people that don't understand even what the ACA is.
Yeah.
What it does. They believe what they've been told.
Yeah, and the budget for navigators has been cut way back. Indiana's has been cut drastically back.
90%.
Yeah.
Navigators, those are the ones who help people?
Yeah, the budget for them in Indiana has been drastically cut. So we're losing ground. Okay, and it's not even across racial lines. So this is U.S. Census Bureau for 2016 with Native American data from 2014. But at that point, the white non-Hispanic population uninsured was whites were basically 6.3% of whites were uninsured. Blacks, Hispanics, Native Americans, Asians. So it's very uneven in terms of the racial breakdown, and so the numbers are far worse. So the average numbers are about 9% uninsured in 2014, but it's much worse for people of color. The Canadian medical system is one we can talk about for a long time. I've got lots to say. I'm just going to talk briefly about Canadian doctors, because the last time I gave this talk it was to medical students, and so I left the Canadian doctor slides in. Canadians live longer. They spend way less on healthcare than we do. They cover everybody. Canadian doctors make pretty good incomes. Now this is in Canadian dollars, so you got to reduce that by about 24%. But they're making good money. The average physicians in Canada are making $337,000 a year, full-time physicians. So they're doing okay.
I was told by Senator Paul that Canadian doctors are enslaved.
Enslaved. Yeah. So that's it. So it's interesting because that's my next slide.
Especially those eye doctors.
Oh, look at that.
So we got some data here. So they track. So this is physicians, the net loss of Canadians moving abroad, less Canadians returning. It's to the U.S. and back. They track this stuff in 1996 and up to 2002. The net loss of doctors moving from Canada to the U.S. was fairly high. Some years 400 or 500 doctors. That turned around, and now the net migration is back the other way. I can't remember the name of the guy. There was an ER doc in Valpo who I used to know. Didn't know him well enough to remember his name, but that's not saying much. And he was from Ontario. And when I met him in about 2000, he said, as soon as my kids are done with high school, I'm moving back to Canada. And he did. And he said, partly I've got some family there, but partly I want to practice medicine again in a place where I can just take care of people and not worry about if I order a CAT scan, then I'm going to make them bankrupt. And so he moved back to Canada. So he's one of these. He shows up somewhere here as one of these doctors who came from Canada to the U.S., moved back to Canada. You got a question?
Do you know what? Like, it looks like between 2002 and 2004, it switched pretty drastically all of a sudden.
And I don't know what happened there. I don't know. That's a good question. I don't know the answer for why. But it was just, some of this is just, statistical variation. But the trend is pretty clear. Okay. A little more data. So this is from the Commonwealth Fund I mentioned before. They're a very reputable source of international comparison. This is a 2012. I think they do the study every 4 years, so there's probably a new one out now that I haven't put up as a slide, but it won't change things very much. So this is percentage of primary care doctors saying they're satisfied or very satisfied with their practice, and you see that doctors in the U.S. are not very happy. And this has only gotten worse.
Is this because they're being told how many patients they need to get through? Because I just read an article on this.
So I think it has lots to do with all different aspects of the corporatization of medicine. And I don't really fully, it's a little more theoretical as to why, but U.S. doctors aren't happy. That's for sure. German doctors are even more unhappy. They've had a number of problems in Germany that you'll sometimes hear Fox News people talk about. But
I was just reading where we are going to be 97,000 physicians shy of what our population requires by 2020. So the workloads have to be immense.
Yeah, so the shortage of physicians is kind of a separate topic I don't want to talk about too much. But since I've been in medical school, I've seen this go from surplus physicians, shortage of physicians, surplus. So some of it is a perception thing. But we definitely need more doctors. There's no question about that. And we're bridging that gap some with other ways, including nurse practitioners, physicians assistants, and stuff. But just the point is, U.S. doctors are cranky, and yet they're worried about taking a system that's more like these folks, and these people are happier. So that's great.
I
We
have a
should
question.
change.
You're gonna find that I'm interested in the statistical highs and lows a lot. So why is Germany, along with America? Do you know why their doctor status? Because there's,
A couple problems in Germany. One is they've got kind of this hybrid system. It's a universal system, but it has a lot of private insurance companies. They're all non-profit, and they get frustrated with some of that. They've actually minted too many physicians in Germany. That's why in Germany lots of times physicians ride ambulances. They probably got a few too many docs, which has depressed physicians' incomes. I don't really fully understand it, but I know that German doctors have been a little cranky, and it shows up in this data. Let's see. Okay.
send them over here.
Yeah. So why do we spend so much? Okay, so here's our riddle we're trying to answer. Why do we spend so much money and get so little for it? Okay, because remember, more data. So is the problem that we're somehow sicker? You said maybe we're healthier because we don't go to the doctor so much. Is the problem that we are somehow more sickly people and that we're more expensive than to take care of and we get sick too much more? So maybe it's our habits. Maybe we have bad habits. But then, so smoking prevalence, well, it turns out you can't blame it on smoking. Because we smoke generally less than most of these European countries. If you've ever been to Europe, you know they smoke like crazy in Italy and France. Although, so you can't blame it on smoking. Here's alcohol consumption. It's just liters per capita. Here are all these different countries. Here's the OECD average. United States and Canada. So you can't blame it on drinking. Of course, Brandon, as a statistician, you will immediately recognize that perhaps this is an argument that we don't drink enough.
He's in France right now.
Maybe we drink more.
Drinking.
Yeah, antiseptic qualities of alcohol.
The antiseptic qualities of alcohol, the tonic qualities. So next round's on me. Okay. Maybe it's old people. I mean, I was taught at a very young age to blame the old people. Now I am one of the old people. But actually, we've got a younger population than all these other countries again. And of course that matches with the life expectancy data that I showed you. So these other countries and older people are more complicated, more expensive to take care of. But we can't, these other countries have a higher burden of elderly folks, and they're still given better health care for less money, okay? So you can't blame it on anything demographic. We tend to be the heaviest country, but obesity is not nearly as much of a health factor as smoking and drinking. But yeah, I mean, we could be healthier, but basically you can't blame it on genes. So why do we pay so much for such poor quality? Okay, so here we are back to, okay, so we get the most expensive health care in the world.
Middleman.
We got terrible, we don't have the best health care with the minimal mortalities. So you guys are so good. So, but we've got this bizarre system. So here's the growth of physicians and administrators. Again, this is all published, peer-reviewed data. Starting in 1970, going up to 2014. Oh yeah, my color coding is off. This should be the blue here, or else this should be the green there. But anyway, so over the last 50 years, almost, what we've seen is that the number of physicians has gone up slightly, and the number of administrators has gone up like crazy. So it takes a lot of people to prevent people from getting care, because that's what our system does. Our system is based on trying to keep people from getting care. It takes a lot of people to do it. There's a lot of overhead.
I have a suggestion. You might want to consider the next time you show this, if you could add to this slide the growth of population overall.
Oh, the overall population, right. which has risen somewhat for sure. Yeah. And so again, peer-reviewed data, overall administrative cost per capita between the United States and Canada, you see just this huge difference. The Canadians do not have nearly the inefficiency and overhead that we have. The insurance companies are a big part of it. You know, it used to be that the doctor's office was the doctor, the nurse, and the receptionist. Now it's the doctor, the nurse, the receptionist, and the billing office. We have this incredibly crazy patchwork quilt system of insurance and non-insurance and different programs. It's incredibly inefficient to run. We spend about 31% of our overall healthcare dollars on administration, overhead, and profit. The Canadians, no country spends as much in overhead. The Canadian system runs about 4% overhead, maybe 5% overhead. We're 31%. Which, the amount of waste is incredible, and it's because we've got just this complicated, crazy system. Paul Krugman said a few years back about the medical industrial complex. Remember that what the rest of us call healthcare costs, they call income. There's a lot of money in our system. So, so we'll take a second on this slide. So this is a guy who's at my alma mater of Dartmouth. He's a pediatrician. He studies healthcare policy. And he says this is kind of a truism, but he says every system is perfectly designed to get the results it gets. So people sometimes say, you know, we've got a non-system of healthcare. Well, yeah, we don't have a system of healthcare. We have this crazy market-based thing that has evolved. But the thing about our system is it's designed to produce the maximum amount of profit. It's not designed to provide quality health care to the most people. It is designed to make money. That's what a market-based system does. It's designed. It wasn't designed by one person, you know. It has evolved to be, by the market forces, to be a system that is exquisitely designed to make money. That's the mess we're in. So, health industry profits, 2016. So the providers, so that's docs and nurses and physical therapists and so on, take about $2 billion out of the system for our salaries and our money. Some of the middle people, here's $5.9 billion. The pharmacy lab benefit managers, $10 billion. The durable medical equipment and supplies, $10 billion. The health insurance industry makes $15 billion in profit, and the pharmaceutical industry, of course, dwarfs it all with $67 billion in profit.
Industry pisses me off so much. I'm sorry.
Well,
I am a medical candidate for like everything that they want to try, and it's ridiculous because I'm allergic to almost all of it. Almost every single antibiotic out there I'm allergic to. There's one right now that they know of that I can use for right now. And so it is until I become allergic to that, and that's a very good possibility. But this is a terrifying industry for somebody to use you as a lab rat, pretty much. You know, because they just keep pushing whatever is the newest thing.
And meanwhile, while we get all $67 billion in pharmaceuticals, medical cannabis, which is the most effective pharmaceutical out there right now, is verboten. It's just, nope, you can't do it. It's a
And I'll tell you
gateway
what,
drug.
as a person with chronic pain, I use CBD oil. I use the gold label CBD oil. That works. It really does. And you know, I'm somebody that can absolutely attest to it because I have severe chronic. I have a screw sticking half an inch out of my foot right now that I'm having removed tomorrow, and I take CBD oil for that, and it works.
So the pharmaceutical industry is a whole other lecture. But, I will point out that everybody on this list at least makes something or provides a service, except for these middle people. The health insurers, they don't provide any service. They don't provide any product. They what? They deny. Yeah.
Nice service.
So, I mean,
And they boss doctors around.
yeah, they're miserable. So, you know, when you think about it, these for-profit insurance companies and the few non-for-profit surviving insurance companies are just like the for-profits. How do they make a profit for their shareholders? Well, they gather premiums, hopefully from healthy people who won't get sick, and then they pay out for health care. And so when you see their balance sheets, the term that on their balance sheet for the money they pay out is called their medical loss ratio. It's kind of obscene, is that, you know, Wall Street wants them to have a low medical loss ratio. That means they're mostly, a high medical loss ratio, meaning that they're mostly keeping the money and not paying it out for care. So the insurance companies are profitable by bringing in money and then denying or avoiding paying for sick people to get care. I went to medical school to take care of sick people. I'm just so diametrically opposed to the for-profit insurance industry. I just think they're gonna go. Okay, so here's the cartoon. This is actually a 10-year-old cartoon. Yeah, Doc, can you see the problem? Yeah, I'm afraid so. The insurance company's in the middle. So I can get you all these slides. Yeah, I can get you all these slides. So we're just about done. So what about the Affordable Care Act? Okay, so the woman says, "Are you in favor of the Affordable Care Act?" The guy says, "Absolutely, anything better than that job-killing socialist disaster Obamacare." The headline says, "Public still confused about Obamacare." This is a really old cartoon. It's still applicable. People are still confused. Now, okay, Donald Trump. Yeah.
I used to work for him. Ew. Oh, yeah.
So Trump has said some interesting things about healthcare.
He sure has.
Including, I'm just going to pick a few. In the book he wrote in 2000, he said that the goal should be clear. Our people are our greatest asset. We must take care of our own. We must have universal health care. So that was in 2000. He wrote that in his book. At the first presidential debate, which was in August, I believe, of 2015, he said, as far as single payer, it works in Canada, it works incredibly well in Scotland.
Fake news, right?
He said this. Now, he got a lot of grief from the other multiple candidates, and he didn't use the word single payer again in the campaign. But just a couple months later, he said on 60 Minutes, this was in November of 2015, he said, everybody's got to be covered. This is an un-Republican thing for me to say. I'm going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much better than they are taken care of now. Now, I'm not putting this up there to say, okay, we're going to hold him to his word, because we know that's... But the interesting thing to me is that he said this publicly multiple times. There's another quote where he says, I say this stuff to Republican audiences and they cheer. I should put that one on here because it was really interesting. So, I mean, you can say this stuff and not commit political suicide, even as a Republican. It's really interesting. So this guy Angus Deaton, another Nobel Prize winner in economics, he has published, he and his wife Ann Case are professors at Princeton. They have published some amazing stuff. They're behind. You may have seen this stuff come out last year that for white males, life expectancy has been dropping the last 2 years. They've published a bunch of stuff on that. But he is known as a conservative economist, very conservative economist. And so he said this last summer. He said, "So I, who do not believe in socialized health care, would advocate a single-payer system because it will get this monster that we've created out of the economy and allow the rest of capitalism to flourish without the awful things that healthcare is doing to us." So there's so much, I mean, we're seeing that looks like we're at a tipping point. I don't know how this is going to play out, but Warren Buffett, if there's an icon of capitalism, he says healthcare costs are the tapeworm of American economic competitiveness. And we're going to have to change this thing. Okay, so just, this has all been passed, so this is the present. So here we are, and now we've got places, people like the Center for American Progress and the Urban Institute coming out with these things where they're saying Medicare Extra, Medicare Plus. I'm suspicious of these folks.
Me too.
I'm very suspicious. Both of these groups published things during the primaries for Hillary against Bernie. And healthcare is one of the places that they attacked Bernie. And so, these are, Democratic Party, the left side of the Democratic Party, but not the Bernie wing. And so I think there's some tests that need to be met for any of these alternatives to pure Medicare for all, clean and simple.
Well, they're corporate Democrats.
Corporate Democrats, exactly.
That's exactly
So we got to make any test, any program that doesn't just cover everybody. We got to be pretty suspicious of that. And say, we'll get there eventually. The Affordable Care Act still left over 25 million uninsured. The test is you got a minimal to zero out-of-pocket expenses. Bernie was going to put out-of-pocket expenses in his bill, in his Senate bill. Here's food cut, and we Physicians for National Health Program led a hard push on him to not have copays and deductibles as part of his plan. We got any plan that protects the profits of private insurance companies. I can't go along with that. And any plan that makes our complicated system more complicated, to put in some kind of a third wheel, it's like a sixth wheel of a public option, I'm suspicious of. There's things about kind of sound good, and anything that restricts patients' choice of doctor and keeps these things like narrow networks in place, I'm against all that stuff. So I want to have a plan that guarantees full coverage for all Americans, eliminates copays and deductibles, removes corporate middlemen, streamlines billing and administration, and allows patients to see the doctor of their choice. So I'm going to turn off the slideshow and let us get our food, and then I'm going to talk just a little bit more, because I can't stop talking.